Hi, do you know the difference between water-soluble and fat-soluble vitamins? My name is Sibirio Bogo. I'm a medical doctor and specialist in public health medicine. I'm also the host of Happy Birthday Wellness Quiz, your health promotion and disease prevention podcast. In this episode, I'll be discussing the difference between water-soluble and fat-soluble vitamins and the public health implications. So generally, there are two types of nutrients: macronutrients and micronutrients. Basically, macro simply means they are required in large quantities, and macronutrients include carbohydrates, fats, and proteins. They're usually measured in grams. Micronutrients, so micro simply means small quantities, and these ones are usually measured in milligrams as well as micrograms. So when you see these signs, you'll see a sign like that for the same. Carbohydrates give us energy, whereas micronutrients do not give us energy. So remember, you actually need micronutrients in your diet for you to be able to utilize the macronutrients. Water and alcohol are also considered as nutrients. But just remember, water does not give us any energy, whereas alcohol, which is part of some people's diet, gives about 7 calories of energy per gram. So basically, vitamins are organic compounds, and as I mentioned, they are required in small quantities to support specific structural or metabolic functions. They can be divided into fat-soluble and water-soluble vitamins, and this has a lot of implication in terms of how we use them. Fat-soluble vitamin are A, D, E, and K. If you don't remember, the acronym is ADEK. So ADEK refers to the fat-soluble, and I'll be telling what this means. The water-soluble vitamins are basically the B family. These ones here. That includes things like B1, B2, B6, folic acid, and then ascorbic acid, vitamin C, as well as vitamin B12. So what's the difference between water-soluble and fat-soluble vitamins? Now, this is an important distinction to know. So water-soluble vitamins are easily dissolved in water, and any excess is excreted in urine. As such, deficiency occurs faster than for fat-soluble, and frequent intake is usually recommended. Because excess is exceeded, toxicity is also less common. So on the other hand, fat-soluble vitamins dissolve in fat and are stored in the liver. Deficiency is lower because they are stored. However, toxicity is much more common. So let's take the example of vitamin C, which is a water-soluble vitamin. The recommended daily intake for adults is between 75 and 90 milligrams per day. Now, any intake exceeding 100 milligrams per day, so if you take 100 milligrams per day, you basically absorb 100% of the vitamin C. However, if you take anything more than 1,000 milligrams, then you only absorb less than 50%. So remember, the more is not necessarily useful. And then, as we said, the body doesn't store any of vitamin C because it's water soluble, and it tends to be excreted in the kidneys. It means that taking expensive vitamin C supplements is a waste of money because all you produce is expensive urine. Now, here's the thing. Vitamin C is found in various fruits and vegetables, most commonly in citrus fruits such as oranges, lemons, and grapefruits. But basically, any fruits and vegetables, including things like peppers, broccoli, cabbage, kale, tomatoes, and potatoes, basically have vitamin C, and you can actually get enough vitamin C just from eating enough adequate amounts of fruits and vegetables. So briefly, the different types of vitamins and their functions. Vitamin is actually a long subject, so I won't spend a lot of time. Just want to emphasize one of the functions of vitamins, and that is the antioxidant properties. So vitamin A, vitamin C, and vitamin E, as well as minerals such as selenium and phytochemicals, act as antioxidants. Basically, when we talk about antioxidant, it means that they tend to neutralize the free radicals and stop the process of oxidation. Oxidation causes damage or alteration to cell membranes as well as DNA. So free radicals that cause oxidations are linked to diseases such as cancer, atherosclerosis, arthritis, diabetes, kidney disease, as well as cataracts. Now, the various environmental factors that increase free radical formation, such as sunlight, polluted air and water, radiation, asbestos, smoking tobacco, as well as toxic chemicals. So these vitamins are useful in terms of dampening the effect of oxidation. That's why they are also linked to prevention of cancers, particularly if you consume a lot of fruits and vegetables. So we'll look at the others, but we'll discuss the rest in subsequent episodes. Thank you very much for listening. This podcast was brought to you by Kike Afya, Health Leaders Podcast. My name is Bilu Bogo. I'm a medical doctor and specialist in public health medicine. Now, we rely on well wishes to bring you this content, and you can support us by subscribing to my YouTube channel, liking, as well as sharing with family and friends. You can also support us through the M-Pesa till number 766-500 or the M-Pesa mobile number 0720 95 82 50. Now, please be on the lookout for subsequent episodes. Bye-bye.